Welcome to International Longevity Center, India. Thank you for using our official YouTube channel. Kindly subscribe the channel and tap on the bell icon which is present below the video so that we can keep you updated.
Okay, hello everyone. Good evening. My name is Yashoda Kedar Patke, and I welcome you all on behalf of International Longevity Center India in this webinar series. Today, we are very fortunate to have Dr. S. Siva Raju as a guest speaker, and he's going to talk about social and economical aspects of aging, the changes perceived in the present pandemic situation. I will shortly introduce him, and then we will begin the lecture. So, Dr. S. Sivaraju is the professor at Center for Population, Health and Development, School of Developmental Studies, and chairperson for Center for Excellence in CSR at Tata Institute of Social Sciences, Mumbai campus. He holds postgraduate degree in population studies and statistics and a PhD in regional development and health and family welfare. Being an expert, you can see that, and you are going to experience it, I'm sure, that being an expert in various fields like aging, health development, corporate social responsibility, research methodology, and so on. He's our, that is ILC-I's honorable director and also a resource person for United Nations International Institute of Aging, Malta. He is a member of various different committees which are very vital in taking decisions at national and international levels. I'm just going to mention few that he's the advisor to the Ministry of Social Security, Government of Mauritius, and I'm sure he will mention few of his experiences in Mauritius. Then also he is the president of Indian Association for Social Sciences and Health, coordinator of the UNFPA initiative on building knowledge base on population aging in India. For a researcher like me, BKPI report are like a treasure because they have very good information and data on aging issues and actually senior citizens in India. So he's also the part of Global Aging Network. So Dr. Sivaraju, I welcome you in this meeting and I request you to kindly begin the lecture. Thank you.
Thank you, Shraddha, for your kind introduction. I hope you can hear me.
Yes, sir. Yes, sir.
Yeah. At the outset, I thank Mr. Jain Tumrankar and also Anjali Raji for inviting me to this event. And it's a fortunate for me to associate with the International Longevity Center for a longer period of in the field of aging because it is ILC, given its international standing, it will be a good for all of us to come together and interact and share our knowledge and strengthen our understanding on aging issues. So to that extent, my association with ILC is very important. And I congratulate ILC team for organizing this national level series of our interactions to begin with. And again, I am very fortunate that this series, it will be starting today onwards. So every Saturday like that, they are planning. And first lecture is very good. So thank you, Anjali. Thank you, Mr. Jain Tumrankar, and also Yashoda, and also all my team for giving me this opportunity. And I think the topic which I'll move on now to PPT. So I hope you can see this very soon. Yeah. So let's move on. As I've been requested to talk about the social and economic aspects of aging, with a special focus on the changes that are mostly perceived and also some of the facts that exist during our COVID pandemic situation. So this is so into three aspects. To begin with, who is elderly in India for whom we are focusing our attention today? What is their socio-economic demographic health profile? What is the extent of their vulnerability? What is the way in which they are living in the context of their family situation and in the community life and the type of the role played by various stakeholders supposed to take care of this elderly. So this context will greatly help us to, when this is the situation, how they have been exposed during the pandemic situation, and that how best we are addressing. And at the end, I would like to see that what are the various ways further we have to focus so as to see that our elderly are taken care of. So as I mentioned, to begin with, let us understand when we are talking about what is the situation in which our elderly are placed. That is very important. And as you see in the slide, that our elderly population, as per the latest census of 2011, we have already crossed 100 million, and the growth rate, which clearly shows that it is almost double compared to the general growth rate of population. That means the speed of aging is almost accelerated, and that it occurs for every double the percentage compared to our overall general population growth. So this clearly indicates that aging is here to stay. It's not just a movement of a stage of people going in a particular period, but the society itself is moving to aging society. So we have to accept this situation that aging is here to stay, and we are crossing this transition, especially in the demographic and other aspects, so as to see that the elderly, how inclusive our development and how accommodative their needs, especially given their vulnerability and heterogeneity. So that is the context which we have to understand. And the other indicator like old age dependency ratio, because if I expect that 60 plus or dependence on the working age population of 15 to 59 age group, who are mostly the people who are working for them. And what happens is that dependency is calculated as old age dependency ratio between these two sections, and that is steadily increasing. And that indicates that the extent of dependency is increasing day by day. So our census for every 10 years, which we have counted, and even for future also, it is expected that dependency is going to increase. That means the burden, what we perceive, the burden of elderly on the working age is going to increase. It's not that it is going to reduce. Now, when we are talking about the socio-economic context, we have to understand that we are talking of these elderly who are born 60 to 70 years or 80 years earlier. And given that time, the literacy levels, the school infrastructure, educational facilities, the level of literacy is very, very low. And if you see over a period, that no doubt it's a very welcoming that our literacy is improving thanks to the efforts of government and various other developmental professionals, how they are focusing in the social developmental activities is a welcoming. But we have to understand that there is always a big difference between the general literacy and the 60 plus age group literacy. The percent of non-workers, those who are not contributing, is another important indicator, because there is a the percentage almost above 50% of our elderly, they are not working. But the other side is that around 40 to 45% they are still working after attaining 60 plus also. Now coming to the very important aspect when we are talking about Indian context is that marital status plays an important role, especially when we are seeing the differences in gender-wise differences, when we are seeing in rural-urban variations. There is a very significant important stage is that the marital status of females indicates that the widowhood incidence of widowhood is very high, and more than 50% of our elderly after attaining 60 plus, they are widows. And that widowhood increases to the extent of 80% when they come to 75 plus. So that means that the spouse presence makes a lot of difference given their low socioeconomic status and already the extent of dependency on other members of the family and society. So the marital status is another indicator of their vulnerability, which we have to accept that in the Indian context, that incidence of widowhood is very high, especially in the case of female elderly. And as you see, the growth rate of elderly population, the growth of female elderly is very high. That's what we call it as feminization of aging. So aging is one type of vulnerability in India. Furthermore, feminization of aging, being females coming to higher age brackets and living longer, is another indicator for the extent of vulnerability among them. So what we are talking about aging, we have to keep in mind that we are also especially focused on feminization of aging. So who are highly, invisible in developmental programs. So whatever programs which we have, there is a very high skewness in terms of not addressing properly for both male and female. So this is another important indicator which we have to keep in mind when we are talking about the socioeconomic condition of the elderly people. Similarly, very important is that we call it as a rural elderly population. So 75% nearly of our people, they are living in rural areas. And the characteristics of rural, most of us, we know that they are devoid of developmental opportunities for them. The extent of access to infrastructure facilities, whether you talk of proper roads, proper access to proper healthcare, proper electrification facilities, proper infrastructure, other developmental indicators. So most of the developmental indicators, if you compare between rural and urban, we know very well that the extent of these facilities which are devoid in the rural areas are very low, and that also indicate, in fact, influences the quality of life of our elderly people who are residing in the rural areas. So when access to health is very difficult, and access to infrastructure facilities are not there, what happens is the quality of life is adversely affected. So that is one of the important indicators. So it is a very, very specific in Indian context that our percent of people who are residing in rural areas, to the extent of three-fourths, is another important aspect which we need to address. In fact, one of the important aspects which we conveniently ignore is people elderly who are residing in rural areas. How we conveniently ignoring female elderly, the another way which we are not able to focus to that extent is in the case of rural elderly. So the important aspect when we are talking about feminization of aging is that if you take a sex ratio, that is a number of females per thousand males, which is always at higher level, more females are living. So we are able to be very happy that more and more females are coming to the higher age bracket, but what type of quality of life they are experiencing, what is their issues related to well-being, and what is the way in which we are able to enhance their socio-economic status is a major challenge which we have to address. So these are certain important things which I would like to share upon, and very important that overall when we see the demographic health, social aspects, economic aspects, we have to keep in mind that in Indian context, they're very, very specific given the variations that exist across states, variations that exist across different strata of the society. They are all of varying nature. So what India as a whole gives is a different picture. But if you open the layers with respect to states or within the states with respect to districts or taluks, there's a more and more layers of geography. If you open, there is a wide, variations that we notice. So the challenge before us is that who are these elderly when we are talking? So elderly in a single bunch, you cannot explain in India that we are all these elderly are in one bunch. There is a huge variation. We are having a pensioners, we are having people who are earning and living on a daily basis, and we are having educated versus uneducated. We are having male versus female. We are having a remote people residing in remote areas versus who are in mega cities or in major cities. So, given this heterogeneity, the challenge before us is to understand what are their issues and to address and bring out suitable interventions to address and bring their issues for the program point of view, so as to see that they are all taken care of. I don't need to mention all of you because you are all mostly have a clarity of what is the type of family as an institution in India is playing a very important role. So the institution of family started loosening its importance, especially given the globalization, given the modernization, industrialization, and also we are now talking about individualization. So the family as an institution, which is the umbrella of facilities for elderly as a part of the family members along with others, is very important. So that is changing. Why it is changing? We know very well that when the social change occurs, when modernization takes place, when rural-urban migration takes place, the family as a unit, they will not be able to stay together. And there is a shift in the number, there is a shift in the family members. So naturally, that the distance and the way in which the individualization starts penetrating is also is an important context. So we are having a transition families. So the families as a unit is not in the in one way of seeing as in the case of earlier days. So the institution of family started its loosening of its importance, and also the formation of family members is again an issue which we have to keep in mind. So what happens is when there is a transition in the family and the change that occurs is not conducive for elderly and even for other vulnerable groups like disabled like that. So this is another important challenge we have to understand. Why we are talking and focusing on elderly? Why can't earlier days of 2 3 decades back or earlier, not much, discussion went on earlier, mainly because the elderly are taken care of as a member of the family. It is a natural process of coming to the 60 plus or 70 plus, so that there is an assurance by the young members to take care of them. There is an assurance for their respect, their status, their place in the family and in the community. What happens in the process is that when the youngsters moves from away from their family home, when there is a penetration of modernization, when there is a individual earnings takes place, and when there is a competition that comes out in employment in the other sectors, the aspirations when it increases, when all the members of the family are not able to stay together, all these issues are individually and collectively play an important role. The most affected in this scenario are the vulnerable groups, especially in our context, we are talking of elderly. So the question is that there may be earnings may be high, there may be family may be staying in different socio-economic context, but the question is how we are able to provide the type of care that is required, the type of attention that we are seeking for our elderly is an important issue that we have to keep in mind. So the question arises when such type of change is happening in socio-cultural context, the family as an institution, the community infrastructure, everything is changing. Whether it is conducive for elderly or not in terms of their care is an issue which is very, very important for also all of us to understand. The other aspect is, as we have seen, that aging, where not only it is fostered, it is also thanks to our life expectancy increase and it is extending. So we are no more talking about 60 plus. We also have to keep in mind that we are talking about 70 plus, 80 plus, 90 plus like that. So life expectancy, when it is increasing, it is a very welcoming feature. We have to celebrate. But the question is, when we are talking also now for long-term care. So those days have gone. When the elderly person comes to 60 plus, hardly 3 to 5 years they are staying or they are living. Now, the recent estimates show in Indian context, if any individual comes to 60 plus, there is an assurance of living for another 20 years. If that individual is a female, another 2 to 3 years are added for that life expectancy. That means after attaining 60, another 20 to 25 years are assured for an individual to survive. So those, coming to 60 and having an assurance for living another 20 to 25 years, what is the situation of those elderly? If there is a retirement, you can't claim that I have a assured, living, so give me employment. There is no question of such arrangement. You have to live, so that you are giving an opportunity for youngsters. And so what happens is that the retirement age is decided, and if you are lucky in the organized sector, otherwise you continue to work in informal sector and you have to earn for your own living. So the question is that what type of life. That is why we are celebrating that we are having a more and more years of living, but at the same time, what type of life we are giving to that additional years. As UN has given a slogan, add life to those years. So this is one of the important challenges, and furthermore, in a country like India, is an important aspect which we all have to keep in mind. That is why we are saying that aging is a separate entity which we all need to address and take care of this vulnerable group. As I mentioned, heterogeneity. There is a heterogeneity in terms of. I'll give you an example. There are persons who are retiring in 2 or 3 years. They'll be waiting for retirement, and there are other sections of same group who are afraid of retirement because that type of life they are going to face, whether they have completed unfinished familial tasks, whether their children are settled, or whether their caregivers are there to receive them and take care of them. So there is other section who are comfortably placed, who look forward for retirement. So the question is, what is the heterogeneity that exists? So huge variations exist in the quality of life of these people. So the perception and the actual facilities that are there for taking care of our elderly also varies depending on the context in which these people are located. So that is what we call it as heterogeneity. So heterogeneity and vulnerability are the major hallmarks of India's elderly. So and it is very important and furthermore challenge in Indian context, because when the elderly are not homogeneous, the challenges for programmatic and policy oriented and projects related to enhance their financial situation, their socio-economic conditions, their health aspect, all quality of life parameters becomes a huge challenge, because you have to segregate the elderly, you have to address specifically for each section of the population. So the quality of care becomes very complex in addressing for the program managers and for the implementers when there is a wider sections of population of elderly. So this is another important aspect we have to keep in mind. And as I mentioned, feminization of aging. So more and more females are entering into 60 plus bracket. So already they are vulnerable. Already their socio-economic conditions are low when their spouses and other members are there. What happens when they are there in this situation? So as I mentioned, widowhood is very high, and there is a trend now. Demographic stages of data has already clearly mentioned that the proportion of elderly who are living alone, they are mostly among females. That means families are there, but they are not taken care of. So the question of neglect, the question of isolating them, the question of leaving them. So the feminization of aging has to address all these issues. So we are very happy. More and more female elderly are coming to 60 plus. They are living for a longer period in this world. What is their quality of life? Why they have to live alone? Why they have to not having a financial independency? And how are we addressing them to mainstream them along with other sections of population is another important challenge which we need to address. The other aspect of dimension in aging scenario in Indian context we have to keep in mind is multiple vulnerability. What we call aging itself is a vulnerable section. When you are talking about 60 plus, in the absence of financial condition, in the absence of family taking care of them, one category of vulnerability exists by virtue of them coming to the 60 plus bracket. What happens if they are female elderly? What happens that individual is disabled? What happens if that person is illiterate? What happens if the person is living in remote areas? So this all come together individually or collectively. We call it as a multiple vulnerability. So vulnerability of elderly itself is a very simple way of talking, but coming to the different other layers of vulnerability for the same individual, if it occurs, what happens? It will be a very important issue which we need to address in, because that is a very important challenge. So the question is whether you are handling the disabled as a vulnerability, or the elderly of 60 plus, or when there is a uneducated, or the person staying in remote areas. So how are we addressing these issues when multiple vulnerability occurs for the same individual? So this is another important thing which, as I mentioned, very important highlight of India's elderly. Next aspect is about long-term care. So when we know very well, when we are talking about olden days, when the elderly are well taken care of, one aspect which we always have to keep in mind is given the low life expectancy in those areas, the moment they come to say 55 or 60, hardly 2 to 3 years they live. Whereas now, as I mentioned, 2 decades are assured. If a person comes to 60, on an average, another 2 decades of living is assured. So these 2 decades of living, around 20 to 25 years, the long-term care requires. And the higher the age, higher the dependency. And that dependency will have to be taken care of by the caregivers. And who are these caregivers? Already the childhood population is dwindling, and the rural-urban migration is taking place, or migration internationally is taking place. And what happens to those caregivers? And what is the way in which that is where the institutionalization of elderly comes to the extent of helping, but again the cost to take care of, and also to the absence of family members in institutional care, and abuse is increasing in institutional care. So such things also individually or collectively have a predominant influence on the quality of life of our elderly. So in all these things, there is an increased need for health and social care. So this is one of the important aspects which I would like to summarize, that the health and social care will becomes a very major issue when we are talking about this aspect. When we are so they are all individually or collectively have a predominant influence on our India's elderly. Now another important thing which we have to keep in mind, that in India we have a very two major issues. We are very happy that India is a young country. Young in the sense, our youth population of around 500 million elderly young members is a very important, what we call it as demographic dividend. So it is a very good opportunity to utilize this dividend, so that they are the people who do for the India's development. But at the same time, aging is picking up. As I mentioned, it is a double the rate of growth of elderly population occurring. That means aging is increasing and accelerating its speed. And the demographic dividend what we have is a unique opportunity at this stage, which is going to have at least 2 decades. So we are at the crossroad demographically, where our youth population is very high, and at the same time, the young elderly population is also coming up in a big way. So the demographically, these are the two important sections which we need to take, so that the people have the quality of life at what we desire. Very interesting, as I mentioned, that we have given the federation structure of India, states play an important role, and the elderly population are at varying levels in each of these states. So it has a huge, high correlation when we are talking about the developmental aspect. So some of the states which are experiencing a very high development are also those states where the elderly issues are also increasing. And also very important is that the demographic aspects and the overall developmental parameters that I have mentioned or have a huge variation when we are talking about whether you talk about 60 plus or 80 plus. So we have a now young old, middle old, and old. They are at different levels, and the nature of their issues and state-wise variations, which are very peculiar or very specific for India's elderly, we have to keep in mind. Now, as I mentioned to you, that if you see over a period of time, our childhood population is there. The blue line indicates our childhood population, which is steadily coming down. So we are also, satisfied with a small family size. We are accepting our small family size now, and we are bringing our family size, which is very desirable. At the same time, if you look at the working age population of 15 to 59 is almost stabilized, and furthermore it started declining, whereas the light green, which indicates our phase in which our aging population is growing, what we call population aging. So population aging is here to stay, and a very important aspect is how best we are addressing their vulnerability. I call it as there are two types of vulnerabilities. There's set of economic vulnerabilities, there's a non-economic vulnerabilities. So vulnerability, no need that it should be only from economic point of view. There are several, socio-psychological, health aspects which are also, extend the influence of their vulnerability. So We have conducted studies, major 7 states which are demographically advanced in the country, to understand what is the situation of our elderly living in these areas. With thanks to UNFPA support, we have a very large scale data set that we have created, because one of the important aspects in India is that the elderly, like not like in the case of children or women or other sections, we don't have the empirical data. Data is very, very poor. So we have to establish the empirical evidences, because on what basis we are mentioning the issues of elderly, very important that we have to keep in mind. So based on that, we have conducted around 12,000 elderly population in India with the proper stratification to understand what are the situations in which our elderly are located and placed, and what are the ways their programs and schemes are addressed. So some of these indicators, if you see, like a percent of BPL households, percent of Antyodaya households, percent of households with minimum per capita with less than 1,000 rupees, percent of households in lowest wealth and quantile, percent of elderly with no income, percent of elderly not owning any assets, percent of elderly financially fully dependent on the other members, and percent of elderly with no other source of economic support. If you look at all these indicators, there is a huge variation across states, and that individually or collectively have a predominant adverse effect on their quality of life. So what it clearly indicates is that there is an extent of vulnerability, especially from economic front, which has brought a clear-cut, a specific importance of addressing those issues. For example, when half of the elderly belong to households which are below poverty line, is very important for us to understand. The question is how we are, and we have done a study. We came to know that a household may be above poverty line, but the elderly who are located in that particular household, the needs are below poverty line characteristics. That means the person, household, because BPL is representing for household as a whole, whereas the individual elderly who are located, because of their vulnerability, they are not able to have access to financial resources, and their needs are addressed as in the case of BPL household. But they cannot get on their own some of these facilities which are provided by the government by virtue of they being from the above poverty line. So the question arises that what are the ways? That is why when you see whether you have to intervene for household as a whole, or whether you have to intervene from individual elderly point of view. So there are certain issues which we need to keep in mind, that when an elderly as an individual, how best we have to strengthen his or her hands, and also when the elderly located in a household, how best their issues have to be kept in mind, and their issues are very important. We have to keep in mind. Similarly, when we are talking about there is no personal income, and how many people they don't have any assets, it's very important that their individual ownership is not there for any asset. They are financially fully dependent. Almost, if you see, female elderly, to the extent of more than 50%, they are financially fully dependent on their other members. So, given this, economic vulnerability, the issue arises at how we are, taking care of their issues. Similarly, if you talk about health insurance policy, the percent of people who are using it is at very, very low level. So awareness is one side, the coverage is very low. So the, out of pocket expenses is very high compared to any other country. In India, it is very high. So if a statistic shows that though elderly are located in above poverty line, as per government, at one-third of our elderly, if we take as below poverty line, the estimate shows that with another one-third, another one-third will come down to BPL, though they are currently living in APL. One-third of the population can come down with one health episode if they experience. That means expenditure for one health episode will make a difference for that percent of one-third of elderly who are now residing as above poverty line to come down to below poverty line. That means the vulnerability we are talking is to the extent of 70% of our elderly who are financially, economically dependent on the situation. So we are talking about poor. When we are talking about poor, we have to keep in mind that not only one-third as per official category of BPL, another one-third of our elderly by virtue of, they're experiencing health problem, they are always have a danger of coming to the below poverty line. That means individually and collectively, if you combine both, nearly 2/3 of our elderly are poor. Poor not only from health point of view, economic point of view, social psychological point of view. So this is a huge challenge we have to keep in mind. Now look at the coverage. We have a old age pension scheme, we have a widow pension scheme. If you look at, there is a fairly, awareness is there. They know very well that there is a old age pension, there is a widowhood pension, but what is the actual utilization? Utilization is very, very meager. Very, very few people are able to get that facilities. So though some of the states have started initiating nowadays, but we have to wait and watch how best that coverage will take place for whole population of elderly. So the question is that the government schemes which are meant for elderly, though their schemes are there, but its coverage is very less, and we have to create a lot of awareness and connect them for these things. As I mentioned, there are other non-economic aspects also, not only in terms of finance, but there are other vulnerabilities we have to understand when we are talking about elderly, like percent who are living alone. They are increasing. And furthermore, as I mentioned, female elderly living alone is increasing. Percent with the experience of abuse. And to the extent Maharashtra, this you can see 35%. So percent of people who are experiencing abuse in a state like Maharashtra, because not only the senior citizens movement, which has created a lot of awareness among the elderly, and also the extent of industrialization and movement of young members also individually have experienced influenced their vulnerability. Similarly, percent requiring assistance for at least one activity is also extended to the extent of around 10 to 15%. And those who are with acute morbidity and percent of social class groups like belong to SC/ST, there's another section who are also vulnerable, so that their needs have to be taken care of properly. So these are certain things which we have to keep in mind, that we are talking about vulnerability not only from economic angle, also at non-economic angle. So the question arises, when these sections of our elderly population who are already vulnerable with all these things, when we are talking about their issues, we have conducted a series of studies. Consistently, we can see that what are the problems of this elderly, what are their perceived problems. And I am talking of this before COVID. And that when I come to COVID situation, you can correlate what is the extent of their vulnerability now. So when we are talking about the earlier, these are all done earlier. And when we have asked those people, what are your perceived problems? Loneliness, feeling of redundancy, loss of confidence, disappointment, fear of crime or violence, they are all perceived as a serious problem. We have given around 60 problems, and we have asked the elderly to rank them. And these are some of the things. And they are mainly, relatively higher in the case of females compared to males. So mental health problems are increasing. The extent of, feeling that they feel that they are nobody to care them, nobody to take care of them. All these issues are increasing, and that indicates they are completely vulnerable in this thing. One of the important aspects which we have highlighted is that who should take care of elderly in our society? Very important question. Across all these socio-economic status we have asked, it is not that only poor people have to be asked, because the problems comes for every elderly irrespective of their socio-economic conditions. And one of the important aspects which we have to keep in mind is that this always gives the importance that the elderly are attaching to the family for a caregiving. So caregiving role through family is one of the major aspects and expectation of the elderly in our society. And it varies from different context of the elderly who are residing in different contexts. For example, when you are talking about poor, they said that family has to take care of, but they admit that our family has to be strengthened through government programs or other non-governmental sources. So they started asking us that please strengthen our families, strengthen the capacity of our families to take care of us. When there is a high unemployment or underemployment, how can you expect young members to take care of you when there is a housing shortages or when there is a very poor infrastructure in houses, especially people living in low economic classes and people living in slum areas or in remote areas. When there is a problem, all these have an impact on the elderly's quality of life. So the question arises, the poor households, they started telling that we want our families to take care of, that we strengthen our families through different programs and schemes. And that very, very clear that if you move further in all others, well-to-do or middle income group also, that, strengthening at different levels is there. So the question is that in India's context, family is a foremost institution elderly expect, though at varying levels. If you talk about well-to-do, they say that yes, we want to have our independent living because we can afford, but at the same time, we need to contact and regularly maintain our contacts with our young members so that their social participation can be increased, their intergenerational bonds can be strengthened, and such things are there. So the financial aspects dependency may be lesser in the case of well-to-do, but the expectation of the family still continues. So that is one of the important aspects which we have to understand. That is why if you look at the various policies and programs that are designed by the government, it is very important we have to understand that how best the institution of families can be taken care of so as to address their elderly issues are very important for us. Now, given this context, I would like to take you to COVID situation. I think some of you might have already seen that and already understood that when we are talking about pandemic, COVID situation, when you are talking about different age groups, the highest dependency or the vulnerability is mainly for those who are 60 above. So it is very significant that our 60 plus age group, not only the number of cases are increasing. For example, 60 plus, in the first graph you can see when 60%, 9% of our elderly are there in 60 and above years, there in number of cases which they are experiencing with COVID is almost 15 to 20%. And look at the other graph where the same 9% of population, the percent of deaths occurring is a very huge. So as age increases, the elderly who are exposed to COVID and the problems that they experience, the mortality that they get is another important significant. That is where when we are talking about all these vulnerable contexts, have individually or collectively have an important role when such a pandemic occurs. And this pandemic, all of a sudden, if you see, all age groups are exposed. So already we are struggling in increasing the sensitivity for other groups, age groups for elderly care. And imagine how best we have to strengthen the other members' sensitivity in addressing the extent of dependency or the extent of vulnerability of our elderly to issues related to COVID. So these are I just want to submit. Now, when we are talking about aging and COVID, I'm sure, but I just want to highlight certain things that higher chances due to comorbidity. So when already with some comorbidity, if they have, whether it is because of diabetes, because of heart ailments, or because of some other morbidity conditions, along with that, if they're exposed to COVID, then what happens is that the morbidity and mortality is very high among the elderly. Then, given the 70% of our elderly living in rural areas, what happens is the access to healthcare is another important aspect which we have to keep in mind. When they are exposed, how best the access to health can be addressed. Now, when we are talking about the increase in immunity and the food security aspects like that, already we are seeing insecurity. Income insecurity is very high. The financial dependency is very high among elderly. And furthermore, how are they going to take place when COVID situation occurs? Food insecurity, we are talking how best we can improve their nutritional status. And furthermore, now it becomes a further issues which are combined with food insecurity. Similarly, the lack of exercise, restrictions on movement, they are all restrict their quality of life. Similarly, the inadequate support of caregivers. The caregivers, already we are experiencing the limited caregivers in terms of number, in terms of their nature. Now, furthermore, when they are dependent because of the COVID, what happens to those people who are supposed to take care of them? Lack of social participation. You say that you are exposed, so you cannot go out. What happens? You are restricted to your movement is restricted. Those days, studies have clearly shown that those elderly who are having a participation outside world, they are living longer, and their quality of life is better compared to those who are bedridden or restricted in one particular place. So the question arises: the COVID has thrown a lot of challenges because physical mobility is restricted. You are not able to go out. You are not able to go and meet even our elderly people. There are several institutions like daycare centers and activity centers. They are all closed. So what happens is the elderly who are now, it is a big challenge for them to restrict their movements and stay in one place. And whatever technology for communication, for like interaction, like these platforms, it has its own limitation. People are accustomed to meet. People will be very happy to see each other. So those issues. Recently, we have done a study among senior citizens groups. How are their life situation? They say that yes, the technology is there to a certain extent, but we want to see our people. We want to interact. We want to see how their life situation. So physically, meeting makes a lot of difference. So the question is that lack of social participation is a major challenge for the elderly people. Now, what happens? The abuse. We know very well there is a lot of studies also have happened that domestic abuse started increasing, especially during lockdown and also for restricted movements outside. What happens is the elderly, when children are busy with the school, when women are working or going outside for other activities, when working age population, they are going to industries or their office work like that. The elderly have a lot of freedom in movement. So the limited access outside, though it is there, but the limited interaction with other members is also important. Now what happened? 24 hours staying together in the limited infrastructure in the house, that access to, for example, there will be one TV, there will be very difficult to have a time schedules, and so all these things also have a major role to play. Another important which we have noticed is that the pandemic has created more and more unemployment for youngsters. What happens? Those people who are having elderly in their households, they are seeing their young members unemployed. They are seeing their children are not having financial stability. So what is happening is that it impacts the psychological fears of the elderly, because they are seeing it not only for their employment opportunities. The question arises: their youngsters have no opportunities. So where are the financial stability for the families? This given the uncertainty for not having earning opportunities, not only for elderly but also for the other young members, they have an important role even to abuse. It leads to abuse. It leads to silent way of interactions or limited interaction or not having a regular talks, and also the fear, the psychological tensions. All these things erupts, and this is another important aspect comes out, because the limited income and with the no employment or underemployment, what happens to the young members? Because they perceive naturally that their elders becomes a burden and they are not able to meet their needs. So the question arises how the limited income has to be distributed for different age groups. The question arises how was this? Similarly, there is a limited access and utilization of digital services. We are very happy that digitization is occurring, and but again the question is that limited access is another important aspect, which is have a very important this thing. So what happens is we have to understand these perceptions of the elderly and the extent of their dependency in the context of COVID, how specific they are when we are talking about this aspect. Now, I have given two perspectives. One is the situation of our elderly and further situation in the time of COVID. What is the extent of response from the stakeholders? We are very happy that the government, both at the center and states, have their own respective roles. We have a very happy that we have a policy. We have a different programs and schemes. We have a certain level of coverage. But what happens is how best they can be speeded up, because the elderly needs are, increasingly coming up. There is a private sector role is very important. They are also, recognized, and thanks to now CSR and these aspects, very, very significantly they are coming in a big way. But again, they are mostly unregulated, they are fragmented, they are mainly urban oriented. The issues of high cost for which they are labeled, and quality of services, all these issues becomes an important aspect for private sector. No doubt, community-based organizations, whether we are talking about non-governmental organizations or community-based organizations or self-help groups, they all have a very important role to play, but there is a need to increase its presence further. There is a need to support to receive support from government and private sector for them to play individually or collectively to play an important role. Then poor networking among them is a reality. Focus on very basic services as of now they can afford. How best they can improve their facilities is another challenge. They experience a lot of resource constraints. I'm sure most of you know at how the struggles are when you are running as senior groups, and how best we have to strengthen the activities. So most of these activities are with the finance. So when the restrictions of resources are the constraints, how are we facing? And the participation of elderly poor is another important aspect where we are not able to bring them to the extent of bringing them to the mainstream of development. So the question is that we have a different stakeholders, but their presence and their activities for elderly care are at different levels. And furthermore, it is a big challenge now, given the COVID situation. Their role is be accelerated, and we have to see that it will be, further enhanced. Now, what are the key strategies? We need to know. We need a lot of database. We have to understand with proper research what are the issues, what is the extent of their problem. We have to play a very important role through advocacy. Advocacy not only at the state level or country level. We need at grassroots level. So we have to connect them with more awareness and connect them acting as a pressure group. We have to strengthen the capacity building of caregivers, whether it is in the within family or outside in the institutional care. The capacity building of caregivers is very important, because aging itself is a new concept, a new phenomena. So nobody is trained earlier. So we have to understand and we have to tune them so as to see that they are professional and handle in more scientific way. Similarly, resource constraints, as we discussed, so they become the most vulnerable. How best we can, and we have to develop suitable policies, especially like WHO. We are talking now on long-term care, and how best we can integrate the recognized strategies like aging in place, the active and healthy aging, which are very important, especially focusing from life course perspectives. And always remember, we have to have a constant monitoring and evaluation mechanism for every suitable programs that are designed, that unless it is there, the transparency and accountability we can't expect to increase. Now at the conclusion, I think I will conclude another 3-4 minutes. What is the way forward? We need to expect that and recognize that our elderly are a separate entity. The stage has come where our elderly have to be recognized and respected, that their needs are to be accountable and addressed separately. We need to design the programs and allocation of resources for them. Unless you do it, otherwise it will become a half-hearted approach. There should be a very political will, very strong political will, and adequate allocation of resources. When we are talking about policies and programs, in the absence of time allocation, in the absence of resource allocation, they always look like in paper. Unless you increase their teeth, connect them to the mainstream, it will become very difficult. So we need to build sustainable systems which can integrate both social and health services. And also important is that we should not see the elderly as passive receivers of care. Now a stage has come where we are seeing our profile of elderly is changing. The elderly of yesterday's are no more just with a low level of literacy, and they are not able to participate. Now things have changed. The profile is going to change further. So more and more people, we are going to see our elderly who are socio-economically better, who are having independent, financially stable. And for them, important is how the additional years of life which they are gaining, how best they can positively engage themselves. That is where we bring concept of healthy aging, active aging, positive aging, productive aging, successful aging. All these things are coming so as to see that our elderly experience, because this is an opportunity. So we have to think that it is an opportunity of our development freedom, of fruits of development that has come through these years of life. So how best they can be again part of the mainstream of society. Retirement or after attaining 60 plus, we should not treat that they are outdated. They are not in the mainstream. We have to see that they are part of our development. As long as a society include them, that is where we call it as build up a inclusive development, so that and, given the heterogeneity and the different worlds of vulnerability, we need different sections of models of care. One model of care will not address the entire elderly population. We need to have rural elderly differently, urban elderly, major cities. How best each one have a model of care is very important. And also, we have to adopt good practices that exist in similar contexts. We have to see how best in other contexts can be used. And we have to strengthen our governance system, because whatever the loopholes that exist in implementation, we need to, strengthen them. And the final slide, I would like to focus how organizations which are already having a innovative and good practices, they are existing, they're all available. And for example, ILC is playing a very important role in social connection, social participation, promotion of volunteerism, and also the digital programs. And there are so many which ILC has started and increasingly, showing its demonstrative models. How best that can be scaled up across the country and other countries is very important. Similarly, there is a family welfare agency in Mumbai has a Mumbai Cares for its elderly project. HelpAge has initiated self-help groups where financial aspect inclusiveness is there. Mobile medical units where the inaccessible rural areas are addressed by HelpAge. Heritage has an institutional care for health of the elderly. Food security and quality of life. There is a noon meal scheme in Tamil Nadu where they are also placing the elderly to get this midday meal scheme along with children. There is a integrated housing where elderly are given housing along with other general population in Tamil Nadu. And we also have several adult daycare centers across the country. We need to replicate and put that in different areas. And we need to have a comprehensive approach for our dementia, because as age advances, the incidence of dementia and Alzheimer's is increasing. So Silver Innings Foundation in Mumbai has a demonstrated model through its center. Tata Trust have initiated a lot of public-private partnerships that can be replicated by other states. And HelpAge has a digital inclusion. Access to technology is a major role. So there are significant organizations and agencies and associations that are playing a role. But we have to keep in mind that how best our integrated way we can bring out, because always keep in mind the needs are at different levels, and every elderly require one form of facilities or other. So we are talking about our 100 million elderly, and their needs have to be addressed, and they have to play a global role. So if we want to enhance the quality of life of our elderly, we need to see that they all have to be taken place. So let us hope that type of world we will create. Individually, collectively, we all have to come together. We have to play our respective roles so as to see that our elderly are in the safe hands and they experience the rest of the life in a very qualitative way. So with this, I think 5:30 now. I close my presentation. Anjali?
Yes, sir. I'm
Yeah.
Yashoda.
Yeah,
Yes.
Yashoda? Yeah. Is it okay? I will leave it for any questions. I am ready to answer.
Yes, sir. Yes, sir. Actually, we have already got two comments. I
Okay.
mean, okay, Namashivaram sir, he's talking about that medical insurance is very costly for the elders. So, government of India must address this issue that he has just came up. So you can answer or comment on that. And also, I would like to request Nasreen ma'am to have a comment because she has written in the book. Sir, we will take two, three questions and then we'll close the session, okay?
Yes, please.
Okay. Nasreen ma'am?
Am I audible?
Yes, ma'am.
Okay. Thank you very much for giving me the opportunity, Yashoda. Professor Shivaraju, an excellent, lucid, and very clear presentation from you as always. And very happy to be here once again to see so many familiar faces.
Thank you, Nazreen.
I had a comment to make regarding the fact that in old age homes in India, very few mortalities have been reported as compared to countries in the West. And we have always been thinking that the West has such excellent standards of care in their old age homes. But we also heard very almost horror stories from places like Spain and Italy, where elderly people were found actually dead in their own beds and in their own rooms. And this has not happened in our country, and there is something to be thought about in terms of that. And while speaking to some of the caretakers, they said that they had actually not left the old age home either to go to their family or to their village for months together. And this was one of the main reasons that absolutely no visitors and caretakers absolutely devoted to remaining in the old age home. And trustees of these old age homes also to be congratulated for managing the situation so beautifully. I just wanted to add this to the presentation in terms of our COVID response for the elderly. Thank you very much.
Thank you,
Thank
ma'am.
you, Professor Nazreen. I think, as you rightly mentioned, the government is also now thinking that, in fact, there is a 7 working groups. Dr. Bremst also is here. He's also one of the members along with me in another committee. And very interesting that the standards of institutional care we have to frame. What are the standards? There is no accountability. Anybody can start an old age home. Anybody can have their own rates and facilities. So, what are the standards? The quality of care we have to standardize, and we have to give the minimum level of assurance. So, these things,
Yes.
we are very happy. The government is also very seriously thinking to frame such, quality of care framework, and let us hope they are implemented at this immediately, so that these issues can be addressed. But I fully agree with you that there is no accountability, and a lot of abuse takes place, and the issues of their quality of life is at very difficult. So we have to address on a priority basis. Thank you.
Yes.
Yes, Yashoda.
Yes, ma'am. Anjali, ma'am, you want to say something?
Yeah, Anjali.
Yes, sir. Yes, sir. In fact, I just wanted to expand on what Nasreen just said. We've invited Dr. Gangadharan on some of the interventions and strategies while dealing with this present problem, especially with regard to institutional care of the elderly. So, in fact, next Saturday we are scheduling this meeting, and I'm sure he'll cover this very poignant kind of point that you raised about how what kind of horror stories have emerged from Europe, even Canada. ILC Canada, we have our as member, and they've also been reporting real horror stories from Canada. Whereas, as you said, not much of those kind of horror stories have emerged in India. Whether they are unreported or not, we don't know. But hopefully, Dr. Gangadharan would be able to expand on that a little bit more. Yeah.
Okay. Thank you, ma'am. Okay, we are taking the last question, maybe, because we are running out of time. So I request Anupama Datta, ma'am, to just have a question. Anupama Datta, ma'am, unmute yourself.
Yeah, thank you, Yashoda. Professor Raju, good to see you. And of course,
Nice, Anupama. Yes, nice, Anupama.
pleasure to hear you because you always add to our knowledge and you always have that positive spark about your presentations, which is absolutely wonderful in these times. I just have a small question as a researcher. These days we're finding it very difficult to collect data from work on these projects. We can only reach by phone or by computers or something, but others are just left out. So any suggestions on how we can collect data, which I think is very crucial at this moment? So any suggestions on that one?
Yeah, one suggestion which I can tell you is this is very important, because the COVID has shown more vulnerability compared to other situations which we normally talk. And one thing which I saw in one of our recent projects in this also we have initiated is that utilize the senior citizens associations and groups. Through them, if we can approach, and you can form a smaller clusters of elderly, so that we can collect information, because that is became a successful model for us surveys also. So
Yeah.
what we have done is segmentize elderly through senior citizens, associations groups, and that is very effectively we are able to generate surveys.
Okay.
Huh?
Yeah,
So that,
thanks. Thanks. I never thought about that, but I will
yes,
certainly explore that
yes.
possibility. Thank you.
So please try. We have succeeded in bringing this service through senior citizens groups. Thank you.
Thank you. Thank you so much.
Thank you.
Thank you.
Hello.
Yes.
Hello.
Who's this?
Anil.
Balera sir, we cannot hear you. Lakari sir, you want to say something?
Yeah, this for information, Dr. Siva, when our course was going on with WHO about the healthy aging in the 21st impact of 21st century, during the month of April, there are many small countries. They were ready with the project with them to face the COVID issue for the seniors. And what you are rightly pointed out about the limited access and utilization of digital service. In that project, they have mentioned how the digital service will be taken to the corner of the country by way of this digital information. So due to that, I think we don't have data service. What Anupama just now has told, our network is very poor. Basic services are not given properly because we don't have that. So, any improvement do you find last 6 months in about this matter? Digital, digital literacy, of course, now we find in the cities, but how about the rural area?
Yes, I think to my knowledge, it became a challenge and it started now at the same to the certain extent because more and more facilities are now moving and yes, connecting networks with groups and making them. So what happens is in the absence of such facilities earlier, we never thought of. Now it is increasingly seen, and it became a necessity, mother of invention, what we call. So it became important. Unless you are familiar with the digital and connectivity, it is becoming a very difficult. So such programs started coming, but still they are in isolation. I agree that we have a so this is a future. That is why the IT sector has to play a major role, and the digitization is the future of this country. And any country, for instance, this is very important. We have to how best. So COVID has taught us a lesson in this regard that you have to be ready for alternative communications. So that is one of the
Yes,
important things which to a certain extent, we now raise to the occasion. Now, this platform which ILC is created is a proof for it. So, such things have to be multiplied. I am happy that ILC is playing a very for everything like that. These programs have to play very important. This is, I think, this is
yes.
how you have to move.
Thank you, Dr. Shiva. Yes, definitely IIC will play an important role for the digitization because you see nowadays 90% emails and 90% people are talking about the digitization only. Thank you very
Yes,
much
yes,
for your
yes.
wonderful lecture. Thank you very much.
Okay.
Thank you.
Thank you. Thank you, Sivaraju sir, and thank you, audience.
Thank you.
I request Mrs. Anjali Raja ma'am to kindly present the vote of thanks. Yes.
Hello.
I am part of ILC. No need to vote of thanks.
No, sir.
Anyway,
Let's
I,
just
I thank I thank all the participants to devote your valuable time and coming onto the common platform. It is very enriching for interaction for all of us. Anyway, Anjali, you.
Yes. No, sir. Thank you from the bottom of our heart for really taking this up and covering it, as everyone said, so very lucidly, so very comprehensively. In fact, you touched upon several aspects, especially in the present pandemic situation, like the financial insecurity of the youngsters and how it impacts the elderly in the family, possibly leading even to elder abuse. Certain facets that possibly might not come to the fore, but you have expressed it. And as always, you have been, our go-to person, kind of. Thank you so much for this excellent presentation. We are getting a lot of feedback from everyone.
Yes.
Everyone's really enjoyed this. Is definitely taking back. We are taking back a lot more there from this presentation of yours, sir. Thank you so much. And in fact, we are having the next presentation next Saturday, and Dr. Gangadharan, I think he is here with us at this meeting. He will be speaking on it, and we have several experts here whom will be requesting Mala ma'am, Anupama Datta, Nasreen ma'am, all of them to, cover various aspects of aging. And once again, I thank all the participants for being here and, as you said, sparing their valuable time. I thank Umranikar sir for joining us, and Dr. Sivaraju, a very, very big and special thank you to you, sir.
Thank you all.
Yeah, Dr. Shivraj, thank you so much. Wonderful lecture. Really enjoyed it.
Let's do.
Okay.
Let's hope for participation of elderly in spite of this COVID, like this platforms. Okay, I congratulate
Yes.
ILC. Let's keep it up.
Okay.
Thank you.
Thank you, sir.
Thank you.
Thank you, sir. Good day.
Thank you, participants, for joining. See you on next Saturday.
Hello.